interest of time, so that we can stay efficient and effective as Leadership Winston-Salem is wont to do, I would like to welcome everybody to our webinar today. Again, my name is Catherine Perry. I'm the Executive Director of Leadership Winston-Salem. And I have just a few housekeeping measures and announcements to share with you. First of all, Leadership Winston-Salem is recruiting for our next best class ever. If you are not an alumni and would like to know more about receiving your community MBA, please use the link that Jared is about to put in the chat to sign up for an information session in the coming weeks. We are offering both in-person and virtual meetings to meet your every need. If you are an alum and know of one or more people that would benefit from the Leadership Winston-Salem experience, please use the link that Jared is now putting in the chat to nominate a candidate. We'll reach out to all nominees and invite them to an upcoming information session. The Leadership Winston-Salem program year is coming to a close, sadly, and we are ready to celebrate our flagship and Insight graduates. Please join us for celebration on June the 2nd at the Millennium Center for a wonderful evening full of festivity as we welcome the current class into the community trusteeship. Another link that Jared will be putting in the chat will be that to purchase your ticket. We're selling tickets until the end of this week. If you're interested in learning more about community engagement and neighborliness across dividing lines, please join author David Dukeson and I for a conversation on May the 25th at 5:30 at the Central Library. If you have any questions, you can reach out to me and I'd be happy to answer them at kp@leadershipws.org. Now, for the purposes of this webinar, if you have any questions, as I'm sure that you will as we move through the conversation with our guests, I would encourage you to put those questions in the Q&A rather than the chat. It's a much more functional platform for us if you wouldn't mind doing it that way. Without further ado, I would like to introduce our guests today and invite them to turn on their camera. First, we have with us Ruth Burcaw. Ruth is the Executive Director of City with Dwellings, a native of Winston-Salem. Ruth earned her master's degree in public affairs while working for Winston-Salem Mayor Martha Wood from 1989 to 1997, and later became a denominational executive with the Moravian Church, supporting faith communities with leadership and organizational development. She's been with City with Dwellings since August of 2021. City with Dwellings builds relationships with our unsheltered neighbors living in places not fit for human habitation, providing the assistance and encouragement required for them to take steps towards health and housing stability. Most importantly, Ruth is the Leadership Winston-Salem graduate of the class of 1993. Also with us today is Andrea Kurtz, and she is the Senior Director of Housing Strategies at United Way and is leading the implementation of the United Way's Housing Matters work. In this role, she serves with local, state, and national organizations to improve the delivery of homeless services in Forsyth County. She is responsible for developing and managing the Community Intake Center and the Forsyth Rapid Rehousing Collaborative, which includes the support services for Veterans Family Program. She has worked with community partners to develop over 600 new units of supportive housing to ensure the resources to help house our community's most vulnerable members are available. Andrea is an LWS graduate of the class of 2010. Moderating our discussion today is Melissa Thompson. Melissa is the chair of the Leadership Winston-Salem Alumni Program Council and is a graduate of the class of 2020. And without further ado, I would invite these ladies to take over our webinar and share with us everything you have to say today.
Thank you, Catherine. It's joining us, and it's good to have both you, Ruth, and Andrea here with us today too, to talk a little bit about social services in the Winston-Salem community. So let's get started by talking a little bit about your different organizations and the services that you provide to the community. Ruth, do you want to go first?
I was actually going to let Andrea go first because her focus is more umbrella.
Larger. Okay, so let's go ahead, Andrea.
Yeah, I'm happy to. Thanks so much for having us today to talk about the important work we're doing right now in housing. As Ruth said, the work that I do is really a lot of system coordination and helping make sure that for people who are experiencing a housing crisis, that the system of services that are there to support them are working together and working in the same direction. You know, so there are many reasons that people experience housing crisis. right? There's a pandemic, people lost their jobs, right? That caused an enormous amount of stress on the housing system as a whole, from housing providers to tenants to owners. The whole system was stressed during the pandemic. But also people lose it because there's a fire. People lose it because they lost their job and things sort of spiral out of control. People have health conditions, they can't manage their home, they can't manage, and you know, the end result of that is they lose their housing. So there's lots of different reasons, but for every reason, individuals are interacting with multiple systems. So not just trying to figure out how do I get back into housing, but how do I manage my vocational needs? How do I manage my health? How do I manage my, right? And so one of the things that became very, very clear in the middle of the pandemic was anytime somebody identifies themselves as homeless, almost every system in our community, this is not unique to Winston-Salem, it is happening all across the country. Every time somebody identifies as homeless, every other system's responses go to the homeless system. Whether what they are asking for is a job, food, healthcare, the responses always go to the shelter first. So our response as a system has really been, when people have a housing crisis, the most important need to address first is housing. And if you begin to think about Maslow's hierarchy and people's needs, if you are not safe, if you are not stable as a human being, nothing else happens, right? And so people's very basic needs are for food, clothing, shelter. If that need for shelter, and by shelter, I don't just mean a homeless shelter, but I mean a place where they feel safe, a place where their belongings feel safe, that they know they can come to night after night and not have to worry about, will I have a bed tomorrow? They are not safe, and no other work that we try and help them accomplish is successful. So a lot of the work I have been doing is working with homeless service providers, but also our health and human service system, our healthcare system, trying to align folks to support people who are identifying as homeless to make sure that their housing needs are addressed. You know, and I think we've seen a lot of research lately about social determinants of health and how that link between housing and healthcare is so tight. So in that work of coordinating systems, you know, the other thing we have, you know, in my introduction, we talked about the supportive housing services that we have. In the last 16 years, we've built about 600 units, but we're seeing about 12 to 1,300 unique people come through just the homeless shelter system and outreach services every year. So then what we have in our inventory as a homeless service system is not enough to meet the need. So we have a prioritization system for how we identify who needs the supportive housing most. Looking at, if we don't help them with supportive housing, where we're making sure their rent is paid, where we're enhancing it with health and human services support, that they're just not going to successfully be housed. And that's the community intake center's job. And we work with all of the shelters and housing providers in the community to identify who needs housing and then to prioritize them. So we don't maintain a waiting list, we have a priority list. So someone could show up tomorrow and be number one on the list, or someone could be hanging out for a couple months and never make it to the top of the list. But I will turn it over to Ruth, who does a lot more of the front door service, working with folks in a housing crisis.
Yeah, we're one of those service providers that Andrea alluded to. And we work specifically, mostly with, I would say our core population that we work with is who we call the unsheltered homeless population. She referenced about 1,300 in a given year that are in shelters. But we're sort of dealing with any given time at about 200 or so folks who are living in places not fit for human habitation. So they are the unsheltered. And they are folks who really are in need of our support and encouragement as they try to move from the trauma of homelessness to some healing, as well as some housing stability. So we do that in several ways. We do that through outreach. We have a team of folks who go out into the community and find our folks and build relationships with them in hopes that maybe they will eventually reach out to us with some needs or for ways for us to help them. We welcome them to our Community First Center, which is on North Spring in Winston-Salem, and help them with basic needs, as well as connecting them to sort of next step resources. We also, for 10 years, have operated an overnight winter shelter, sort of an emergency shelter in the winter months. And we do that in partnership, of course, with some of our funders of the city and the COC, but also with churches. Local downtown churches are really key to that program that we operate. And then we have some peer support specialists. These are folks with lived experience who are actually working to support some of our, I would say, chronically homeless, or folks who've been struggling with homelessness for a long time, help them succeed in housing, because that's really important. You can't just dump somebody in an apartment after 10 years on the street and expect that they're going to be able to just get going back into fully functioning society. So our peer support specialists walk alongside those folks as they adjust to life as a housed person. And then we work, and where we can, we work to expand shared knowledge and understanding of the various complex issues that surround housing and homelessness. So in a nutshell, that's what we do. So.
And that covers quite a bit, and that's wonderful. And it's sad that we need these services, but there's definitely more need out there than we have accommodations, housing available, and that's been a challenge for sure. I did notice, Ruth, Facebook, I think, post that had gone out that you're discontinuing is it a weekly or monthly meetup where you try to connect people because there just is no access to available housing right now, and it hurts to set up false expectations by holding those meetings. So yeah, it's definitely something there in the community. So when we talk about those people who are the homeless populations, what are some of the common myths that you've heard or that you'd like to dispel about the people that you serve?
I mean, I would address a couple that come to my mind immediately. One is that people become homeless due to character flaws or laziness. And that is a public perception that just persists regardless of what reality is. People are homeless because they don't have anywhere to live. That's why they're homeless. But some have additional challenges, certainly, like addiction or mental illness, a lack of financial resources, lack of a family or social support network. And that makes them more vulnerable to homelessness. So when the market gets tight, when the housing market gets tight, right, they're the ones who sort of fall off the edges because they're really the most vulnerable in that regard. But it really is a combination of individual and structural and systemic issues that we're talking about here that kind of make it all play a role in this. And then the other one I would specifically mention is that people experiencing homelessness are dangerous, and we should be afraid of them. We manage this every day with all kinds of different folks, but people who are experiencing homelessness are really more likely to be victims of crime than they are to actually be the perpetrators. Being homeless actually increases the risk of being victimized. I think one study I've seen said that about half of homeless people who were surveyed reported experiencing violence. And then if you're older or a female or been homeless for a while, you're even more vulnerable. So stable housing is really the key to safety for our folks, but they're not any more dangerous than any other percent of the population, right? So
Right.
Be the two I'd mentioned. There are many others.
Yeah. Andrea,
just building off of what Ruth said, she addressed many of the myths we have about the individuals who are homeless, and we all in our minds have a vision of what a homeless person looks like. When we look at the macro level, when we step back and look at the data about who's homeless, we can learn a lot of things about what makes someone homeless. When we look at the broadest definition of homeless, which is a person who does not have a regular fixed place to sleep at night, the largest number of people in our country who are homeless are children. Right? I mean, sit with that for a little while as you think about what makes someone homeless. It's right when we look at the data, and we have a tremendous amount of data coming out of homeless services nationally. There is no correlation between homelessness and mental health. There is no correlation between homelessness and substance use. There's no correlation between homelessness and joblessness. What there is a correlation is between people who are homeless and have had high childhood trauma. But even more than that is the correlation between being African-American in our country and homelessness, right? And that's not an individual problem. That is a problem that we as a society created as how over hundreds of years, we have invested and created a housing system that creates space for some in our communities, but not all. And so really the solution to homelessness is housing, and it is being intentional about how we as a community invest in housing in our community. So pre-pandemic, before the really big housing crisis happened, the city's housing study estimated we were 16,000 units short of housing for our community. So sit with us, right? We're seeing 1,300 people a year come through homeless services, 16,000 units short. So we have these 1,300 people. There's not enough units for them. That was even before the pandemic. What we're seeing now is in the last year, rents in Forsyth County have increased over 30%. At the same time that our rents are increasing in our county, the HUD rates of payment that we can use for subsidized housing payments, those rates went down. So the gap between what's available at an affordable rate for people with low and moderate income has gotten even bigger. So it is just, as Ruth said, they are closing down their housing huddles. We have a plan, Ruth. We think through how we're going to get people housed, but it isn't because people aren't looking for housing. It's because the housing that we have is so unaffordable and out of their reach, and there's just simply not enough of it.
Okay, thank you for that. And it's quite a challenge when the inventory even isn't there at an affordable rate for the people needing it. So social determinants, which you've mentioned quite a few just already, they're so interrelated to each other. And one need then begets another need and another need too. Even as you establish a permanent house, there's then how do we furnish it? How do we have the money to pay utilities and all of these other things that come along with that? As you work to affect change in these areas, what is your approach to that? And Andrea, do you want to go first?
Right. I mean, I think there, again, Ruth and I come at the same problem from different directions, right? Because you have to come at it and serve the individuals who are being hurt and the individuals who need care. But a lot of the problems are system level issues. They are policy issues. They are not necessarily, some of them are city, state, national level policy. Some of them are organizational policies. Some of them are investment policies. Some of them are just how we've decided as a community to organize how we do housing. I can't remember, but the exact percentage, but some enormous amount of land in Forsyth County is zoned single family, right? So if you think about just that policy, which has nothing to do with homelessness, right? It has to do with how we build housing in our community. We have significantly preferenced housing development into single family, right? We are not going to build enough single family homes to get us out of a 16,000 unit pool. So looking at the policy issues, looking at how do we then coordinate between systems who also have policy problems. And, as I said, many of our homeless neighbors, when they show up at the hospital and the hospital hears that they're homeless, they just send them back to the shelters, whether that's where they came from or not. And, many other systems have that same issue. When we have folks who are applying for a job and they list the shelter as their address, or they list no address because they don't have one and they're not staying at a shelter, right? That automatically tags them, right? And it makes it harder for them to get an employment. So how are we inter-system working so that when people are seeking healthcare, when people are seeking housing, when they're seeking employment, when they're seeking food, right? That we have addressed the barriers between the systems that we create, so that it is easier for them to navigate through.
Ruth, you want to add something?
Sure, I would add a little, I guess, from the sort of the individual perspective, as Andrea talked about, the systemic perspective. We're really working with a group of people who are along a continuum of vulnerability, I would say. Sort of at the core is our folks who are unsheltered and dealing with any myriad of issues. And then we've got folks who are maybe unstably housed or in and out of homelessness. So there's just sort of a continuum of vulnerability. But but the work we do tends to be at the intersection of some of these social determinants we're talking about racism, poverty, violence. These folks have low to no access to nutritious food, to safe housing, to transportation, to positive experiences in general, right? And one common denominator that we certainly do see, and Andrea alluded to it earlier, is trauma. Being homelessness is traumatic, but most of them also likely have experienced a large number of childhood experiences that were adverse, and also just as part of their life experiences in general, experienced a tremendous amount of trauma. And so, I think, and I love to do a little education, right, on the brain. Okay, I'm going to do the hand-brain model, right? You got your brain stem here, you've got your amygdala here, which is your emotional brain, where you're feeling all your things, right? And then you've got your prefrontal cortex, which is usually hanging out, helping you make good, reasonable, rational decisions in life. I would say that our folks are living with their lids flipped. They're living with their prefrontal cortex. They're in fight, flight, or freeze mode all the time. And so being able to help them make the decisions required to make an appointment or to do some of the things that even we find difficult. None of us like voicemail hell, right? But imagine if you're walking around with your lid flipped all the time. So part of our challenge, in addition to just connecting them to the resources that might be helpful, is giving them a safe space, giving them a place where they can relax, where they can rest, where maybe there's a way to start some healing for them. And we're not clinicians, we're just people. But we're really hoping that as we move forward, we can explore a little more about what it looks like for our folks to move from a place of trauma to a place of healing, and how that might affect and help them in their struggle to be stably housed. So the individual piece is also really critical here.
Right. You've got to start somewhere, right? And so figuring out how these systems work within each other, and then where to get things started. So as you look at these different issues, are there certain ones that you prioritize over others in the work that you do?
I mean, we've really, as a system, adopted that for people who are homeless, the first priority is housing, right? Because, as I said earlier, if people are not safe, and they will not be safe if they don't have permanent housing, right? They're always operating in crisis, right? And if you are always operating in crisis, then you can't make good decisions, right? Because your body is so crisis focused. Like, what do I need to do to just survive the next 10 minutes? And so it really is an emphasis on getting people housed first, and then working on the other challenges and issues that make moving up into better economic stability in their life more challenging. And what we found for a long time, we still do have a focus on housing the chronically homeless, which are people who've been homeless for more than 12 months and also have a disability. So when we started this work in 2006, we had over 200 people who were identified as chronically homeless. Through the work that we did in really adopting this model of housing first, before the pandemic, we brought that list down to 30, right? And that was by prioritizing housing to those people for whom, without these intensive supports, aren't going to get out of homelessness. And that was a system policy issue, right? That we fixed by how we connect people to services. Once the pandemic hit, we made some policy level decisions. Who knows if we made the right decision or the wrong decision, right? We had very low numbers of hospitalizations, COVID cases, or deaths within our homeless community, lower than was predicted for us. On the other hand, our chronic numbers are now at 124. And some of that is because it's a system, right? We made the policy decision to keep people safe over the last 2 years. And when there wasn't any housing, particularly when there was a moratorium and there was no movement in the housing market, right? It meant we kept them with us, right? And so we said, we're like, shelters sort of disbanded their length of stay policies. We opened up more kinds of emergency shelters, partnering with hotels in the community to make sure we could get people off the street who had health conditions that made them vulnerable, and our veterans and families. But it meant, because we were focused on that, and keeping people safe. We weren't focused on housing. So we're really starting now as a system to turn back and say, our job in the homeless system is to get people housed, right? And that's our first calling. And once they're housed, we then provide the support to make sure they connect. There are so many services in Winston-Salem to help people. And, you know, as I said earlier, they don't necessarily help you if you come in and say, I'm homeless. They send you to us first, right? But if we can get them housed and they go to those other places in our community as a housed person, they have a better linkage into those systems. But also they're safer, right? So their brain's starting to calm down, their nervous system starting to calm down. So they can begin to start healing themselves, begin to make better decisions for themselves. But that's really sort of how these big policy level decisions come down and affect people on an individual level.
Okay, thank you. And Ruth, as far as prioritizing certain issues over others, really starts with the housing for you for the programs that you have, right? Just making sure they have a roof over their head to receive the services.
From where we sit, though, when dealing with the unsheltered population, you know, we can walk folks through a lot of different hoops and help them walk alongside them. But if there's no place for them to be, then that gets difficult. And we also observe from where we sit, you know, some, you know, there's some folks who can't maintain housing or end up back out on the streets. And so there's a great need for, I think, supportive services once folks are housed, especially our chronic population and some of our unsheltered populations. They need a lot of help to stay housed. And so, I mean, that's a priority for us, and we're still figuring out what that really looks like in terms of how to operationalize that.
Okay, that's great. And there's a question that came in that I think fits really nicely right here. So I'm going to go ahead and ask it now. So Robert Eggleston asked, he'd like to hear about the local partnerships each of you rely on to provide specific services so your organization does not have to take on additional responsibilities. So this speaks to a little bit about how you start with one thing and then other services kind of come into play. So if you can share some of the other local organizations that you work with and helping to provide like a whole person kind of service.
Yeah, so, you know, at my level, in terms of system coordination, we're working with the city all of the time. We're working with the county all of the time. The health department has been so critical for us over the last couple of years as we've navigated how to keep people who are homeless safe. You know, we work with landlords, we work with the court systems, we work with law enforcement. We're working with all the hospitals and medical clinics in our community because homeless people are accessing them all the time. You know, and then we work with human service providers in our core homeless shelters. There's 7 homeless shelters in the community serving different populations of folks. We work with Goodwill. We work with Forsyth Tech. You know, we think about students connecting to Forsyth Tech as such a positive forward step. So many of those students, their housing is unstable, right? And so how do we make sure that our young people that we're trying to get educated, trying to make sure that they have a good start in their life, that their housing isn't what's disrupting their education?
Right. And we try not to reinvent the wheel. You know, as we work with folks, often we're helping them to access their basic needs, clothing, food, that kind of stuff. So we connect them with local food banks, or we'll take them there or go with them or help them understand how to access those kinds of services. So, you know, and places like Sunnyside and Green Tree Peer Support, Twin City Harm Reduction, there's a lot of places that are who we serve overlaps a little bit. And so rather than try to start our own food bank or start our own clothing closet, you know, we really try to connect people to these kinds of services. And there are a lot of great partners out there, and there are many folks within the continuum of care that we, you know, call on to help us depending on what the need is for individuals.
And so this leads into one of the questions that we had is, you know, what are the common needs that your organization has that you seek from the community of volunteers and other nonprofit organizations? So this kind of speaks to that as well. But is there any organizations or services that you'd like to add to what we've mentioned so far? And I imagine the list is long.
Yeah, I mean, the list is very long. You know, all of our human service providers always need money. Money is what makes us have staff that come to work every day. You know, we have a very generous community that's helped support this system. And, you know, as people are moving into their housing, you know, we alluded to this earlier. You know, there was a period in which we were getting people housed and they weren't moving in. We're like, why aren't you moving in? They're like, I don't have a bed. Right? They need furniture, right? And so in response to that need, you know, our community grew a wonderful organization that's been a great partner to us, Green Nest, right? So that there's a place for us as we are getting people housed to connect to furniture and those very basic needs. And, you know, Green Nest really thinks about how, you know, now that the homeless system found a place to live, how do we make that not just a house, but a home, right? So they make sure that they have furniture and dishes, right? And dish towels and cleaning supplies and all those things that when you're moving off the street with your backpack full of stuff, you don't have.
And I came at this question a little differently when I was thinking about needs from the larger community. My first reaction was work on your own trauma. We need people to work out their stuff so that they can be present for everybody else, right? And so that they can work in their own circle of influence to do what they can to create a better world. I mean, that's I went really big picture, but educating yourself, asking questions, being curious, you know, not accepting just what you hear, what the headline is or what you hear, but digging a little deeper and asking good questions. And of course, you know, we need money always. citywithdwellings.org. You can donate online. I mean, you know, we need reading glasses. I just put a post up today where I'm singing for sugar and creamer because the folks, when they come to our center, they need their coffee and it needs to be full of sugar and creamer. So, you know, so those are the kind of things that are literally just needs that we have. People need reading glasses.
Yeah.
A lot of our folks are older adults and they can't, you know, they need good reading glasses. So we'll take your gently used reading glasses and those kind of things. So.
And I think the one thing I'd also like to add, yesterday was a primary election, right? And our community was super excited. We had a 16% turnout. We're a democracy, that sucks, right? We have to, as citizens, take responsible for the fact that we elect our government, and that means we need to show up and vote, and we need to educate ourselves about issues, right? And, you know, at the local level, housing is such a fundamentally important issue. And I was talking to someone the other day about candidates forums related to housing, and they're like, we don't have enough local people who control housing. I'm like, housing is affected by every level of our government.
Yeah.
Right? Whether you're in the House and the Senate, whether you're president, you know, Biden earlier this week unrolled his, now I can't remember what it is, his housing action plan to increase the number of supportive housing units across the country, right? At the local level, we control zoning, we control incentives for who's building what kind of housing in our community. We set fees, right? If you want to buy housing, if you want to build housing, you pay fees to do that. You know, what does that look like? No, educate yourselves and vote. Like that matters so fundamentally to creating the kind of community we want to have, right? And if we want a community without homelessness, you have to vote, and you have to vote for people who understand that the policy levels we make at the city, state, and national level impact what our communities look like in terms of homelessness.
That's good. Thank you for that. So as we look at, you've mentioned a couple times the pandemic. It's come up just in passing through this conversation so far. And it's hard not to think about how things have changed over the last 2.5 years now. What are some of the innovations that have been created in your organizations that you'll be carrying forward? Or, you know, do you see yourself going totally back to the operational perspective you had before COVID, or do you see that there are some changes that are now kind of embedded into how you're moving forward?
I was going to say, I'd let Andrea talk about the hotels and some of the things that were going on because that happened before I arrived, sort of in the middle of COVID. So not as familiar with some of the systemic wide kind of innovations, but I would say that honestly, I mean, we just kept plugging along. I mean, we really never closed. We just armored up and put on all the things and got our people to where they needed to be. And I think if we had one innovation at all, frankly, it was for us as an organization, it was about maybe a little bit better job of self-care, of figuring out how we just can't do all the things or be all the things, and we need to have better boundaries, and we need to take care of ourselves and try to figure out how we can lessen secondary trauma and burnout for folks, and just draw some lines and say it's important to take care of ourselves, and then that enables us to better take care of the folks that we serve. So that was sort of our internal, I think, aha moment.
I think there's a lot of things
Yes.
we've learned as homeless service providers. Pre-pandemic, most of our shelter, particularly all of our shelter for single adults, was congregate shelter, meaning we had 50 to 100 people sleeping in a room. There are lots of ways you can think about that, but once we hit this pandemic, we can't continue to have so much of our inventory in congregate shelter. We have to be able to build out non-congregate options. So we're really, as a system, looking at how do we enhance our ability to provide non-congregate shelter, which means people get their own room. And so that's what, one of the things I think, I'm a great believer that every problem comes with pros and cons, right? There's a silver lining to everything. Our system was able to make and build relationships with the hospitals and the healthcare community in a way that we hadn't before, and I think those relationships will be enduring. I think the relationships and some of the changes we've made into how people are moved from hospitals into shelters will hopefully persist. Particularly people who are not sick enough to need to be hospitalized, but are contagious and shouldn't be in a mass shelter. And I think, while the rest of the world is starting to look at what does post-pandemic life look like, right? And people are venturing into meetings, and people are venturing into gatherings with friends, with family, with coworkers, with ball games, right? The rules haven't shifted yet for the homeless service system. Like, we're still under the same emergency orders, right? The orders not to do high density shelters. If we have people who test positive for COVID, we still have to isolate them for 10 days because the shelter system has the potential to mass spread because of the density in which we keep people. And I don't think we're going back to the density that we've had. Right. The downside of that is, so pre-pandemic, our street population on any given night and time of the year was somewhere between 30 and 50 folks. And as Ruth shared with you, it's now at 250. It's been at 250 for over almost a year and a half now. I don't think that's shrinking. It's certainly not shrinking very quickly, and it's not shrinking until we both address the need and build out a system of non-congregate shelter, and until we really begin to address the supply of housing in our community.
Yeah. So supply really is a big part of the answer to that, is increasing the supply. And then where do we begin with that, right? So for your different organizations, the next we'll talk about is how you measure success, because I'm sure it can be easy to look at all the work there is to do and maybe not recognize the successes that you've had along the way. But how do you measure success for your programs and for your organization? Ruth, we'll start with you.
I sort of combined these two questions, because you also asked about a 10-year goal for your organization. And to me, it kind of went hand in hand with the success question. And, I'm not sure success is really the right word for our work. I think it's more like impact. For us anyway, certainly housing people is the obvious sign of success in terms of ending homelessness. Absolutely. But for us, we see a lot of qualitative outcomes, right? Not as so much quantitative. We can tell you how many people we helped to get Social Security cards or got onto Social Security benefits or maybe ended up housing because they worked with us on a thing. But, we're more likely to, to talk about the person who, is someone who has been unhoused for a long time, who finally was able to move into his own room and do his puzzles in his room, in his little house where he's got a room and a bathroom. And I mean, we celebrate those kind of little victories because it's a person that we know, that we have, become built a relationship with. And so to us, that those little victories, are is what we're looking at. But and then my thought around this sort of the 10-year piece was that 10 years is a long time. And our people have a life expectancy of like 50. So keeping people alive, frankly, is a success for us at times. We had a week not too long ago where we ended up with 3 or 4 overdoses and used Narcan successfully. We count that as a success, right? So our folks are very vulnerable. So anything we can do to keep them alive and to keep them basically healthy and working maybe toward whatever the next step is for them, we count that as a success. If they become stable in housing, well, that's just like a huge bonus on top of that.
And Andrea?
Absolutely, Ruth is right. We celebrate all of our small victories because some days that's all we have, right? So, I talked about coordinated assessment. One of the tools we use in coordinated assessment is something called the by name list. We know everybody in the shelter system, almost everybody on the street by name, and we know enough about them to be able to prioritize them into housing services. For a number of years before we developed better systems for interacting with folks on the street, we also kept something called the not by name list, because there was a bunch of people whose names we didn't know, right? Either because they wouldn't talk to us or they might interact, but just not tell us their actual name. The day we got rid of the not by name list and we just have a by name list, right? That was a victory. Sometimes a victory is someone that our outreach team has been contacting every day or every week and trying to give them a sandwich. They take the sandwich, right? Sometimes that's the victory that's most exciting. But we are also very data driven. We have some big goals. Ruth said 10 years is a long time. Sometimes it's not, right? So when you're trying to end chronic homelessness, 10 years does not feel very long. So we, look at the numbers of folks in our system. We are being very attentive to how long does it take us to house people. So pre-pandemic, it was taking us sort of a system average of about 45, 50 days from the time someone entered the system to get housed. Now, pre-pandemic, 50% of our system came into shelter, stayed less than 2 weeks and left. Right, so that helps bring that average down. Post-pandemic, our average length of stay right now is up over 100 days that people are with us, and that's too long, right? So we're going to start looking again at how long are people staying with us. A lot of that is going to depend on what happens with housing supply and demand, whether or not we can invest in, sometimes the permanent housing move isn't into their own place but back to family. Like, how can we develop strategies for family reunification? We look at how many people we're getting housed every year, how many people are coming back to our system every year. And so setting goals, part of what we do is set goals as a system. So big goals like ending chronic homelessness, ending veteran homelessness, reducing the length of time that people interact with the homeless system. Like, our goal is under 30 days. We would really like people to go from housing crisis to housed in under 30 days. But to get to those big long-term goals, it really narrows back down to small daily steps. What can I do to help people get their documentation that they need, right? So getting someone a lease isn't all, like, it's not just finding an apartment and making sure you can pay for the lease. They have to have a birth certificate. They have to have a social security card. They have to have all this documentation of who they are so that we can help them, right? When we first started, it was taking people like 60, 90 days to get all that paperwork in place. And we've reduced that. It became more difficult in the pandemic when everybody shut down, but trying to make sure that paperwork is not what's keeping people out of housing and keeping that time really short. So we measure a lot, talk about data a lot. And
And you're bringing up some things that I think a lot of people who maybe have never found themselves in a situation where they were threatened with not having a home, things that you don't think about where to keep your papers, how to safeguard those and have those available, because you do need those to get a house, to get a job. All of those things that can bring you out of the crisis that you're in are so vulnerable. And you also mentioned about tracking people coming back into the system. So there is a question about what is the biggest barrier in staying in housing for those who seem to kind of bounce back into the system after having been housed.
Ruth, I don't know if you have insight into that more than I do. I've been looking at the macro numbers. A lot of it is community, so our community adopted the slogan of housing first as the focus of the work for homeless system. And when Cities with Dwellings was born, their tagline was community first, which I thought was a little cheeky at the time. But on the other hand, folks don't stay housed if they don't have community, if they don't have friends, if they don't have family, right?
Yeah.
So humans are innately social creatures. So where you are is where you build family, where you build relationships. And if people are living on the street, that's where their friends and family are, right? If they are living in housing and their friends and family are still on the street, there is a pull for them to come back to that, or they pull their friends and family to them, right? So we see a lot of people being evicted shortly after we get them housed because they're helping their friends, right? Which is a horrible reason to get evicted.
Right.
Because they were trying to be helpful to people that they care about and that bring them joy in their lives. And so really trying to help think through, how do we help people who are transitioning, particularly people from very long-term homelessness, where they really do, their whole world is around street survival, and that's where their relationships are. And that's how they know how to access things. How do they relearn? How do they rebuild a community in housing?
Right. I think of the things that our peer support specialists do to help our folks who are in housing. And it's simple things like understanding how to use a debit card and what that means, and what having money on a debit card means, and what it means to budget your money over the course of the month so that you don't spend it all the day you get your check. Looking at things like making your own dinner instead of figuring out how to take a bus to McDonald's and back, but making your own dinner involves recipes and shopping and, using that debit card and all those little things. And also, I would reiterate what Andrea is saying about community. I mean, finding your own place in your own community. And a lot of our folks are dealing with mental health and or addiction issues, and they are either unable or unwilling to access the system by themselves for any number of reasons. So those become challenges on a day-to-day basis sometimes. But it is really, I think Andrea hit the nail on the head with the community piece. If they don't have a place where they really do feel like they belong, you've been living under a bridge with 10 other people, and all of a sudden you're sitting in an apartment by yourself, miles away from those people. That's hard.
Yeah, that sense of community is so important, and the sense of belonging somewhere. I can imagine that is a big driver towards staying stable, is being somewhere where they feel like they belong, and that's important. You don't think about that; it's kind of a intangible, but you need that, right? So one of the questions from our audience, addressing shortage of housing units. I see large multifamily units being built in the suburbs like Kernersville and other outlying areas. Is some of the issue transportation and how we have zoned housing sprawl, or just that some homeless services are in the downtown area and there's no affordable housing in downtown, or the housing is not near their jobs? So I think this is where transportation and the access to work and again, this is just, housing is one piece, and then there's transportation and where jobs are located. So I think the question here is like, what are your thoughts about that, about where the housing is that is available and how that impacts transportation and access to the things that they need, groceries, jobs. It's a big question.
I think all of that, right? So, you know, as I talked about earlier, how we have zoned land in our county determines where you can build what kind of housing. And so much of our land is designated for single family, you know, and where we will accept people, right? So we, you know, when we were more involved in building actually ground up builds of supportive housing, we would find sites we think are perfect. They're near bus stops, they're near grocery stores and drugstores, they're walkable distance to places that folks could get jobs, they have healthy communities, and the neighborhoods would fight us, right? If we continue, all of us, to have the attitude that these people shouldn't be living in our backyard, we will continue to have homeless people. You know, but one of our greatest successes, we built a 12-unit apartment complex for folks who are chronically homeless. Did a lot of work with the neighborhood about why this was going to be an asset to their neighborhood to have this project there. And they've been there over 12 years now. We never hear complaints about them, right? They're not homeless folks now, they're just people that live in an apartment in a neighborhood that's healthy. And so there's so much fear of what it might be to have people whose income is lower than ours. Income changes, right? You know, we move people into housing, they have zero income. They don't always stay at zero income. But they're never going to be able to change if they don't have housing, right? And so we have to be willing to say, yes, I want people living in my neighborhood. I want people to have access to transportation. I mean, the fact of the matter is right now we have so little housing that is affordable to people who are earning below 50% of area median income, right? Those folks can include teachers, firefighters, police officers, right? Folks who work in the service industry. They can't afford to live in Forsyth County, right? I mean, I'm not talking just Winston, I'm talking Forsyth County, right? We are starting to have to look out of Forsyth County to find affordable housing for folks. So if we don't begin to address these issues, right, the people we rely on to run our community can't afford to live in it.
Ruth, anything you want to add there? Just ditto, right? Everything she said. Yeah. So, and that kind of responds to one of the questions that we had come in is, there's a lot of new housing in the downtown area. Does this help or hurt those who are chronically needing stable housing?
It's not helping because it's pushing out what little affordable housing we had in the downtown area. You know, rents right now in some of the new builds are $1,400 to $2,800 a month. I was on a call yesterday where, because of the pressures on the housing market right now, that we are looking at in the very near future of having rents in these new apartments that are coming up being close to $4,000 a month in Winston-Salem. Right, I mean, think about that.
Wow.
My mortgage isn't anywhere near that.
Right.
And so we have to be really attentive to that. And, you know, on the other hand, the more housing we have, you know, one of the things that we've seen in the housing market is, when I say we were 16,000 units short, I mean, that's for everybody. Like, we just have 16,000, we don't have 16,000 people without actual units. So what happens is people with more money then are able to sort of press lower into the market, right? If I can spend $2,000 an apartment, but there are no $2,000 apartment, I might go rent one at $1,500, right? And if I could rent at $1,500, there's none of those, I may go down to $800, right? And then we start pushing out the lower income folks who can't compete. And that's a lot of what we've seen over the last probably 10 years in our market, is that sort of downward pressure pushing out lower income folks. So the more higher income units we build, you know, the more pressure it takes off of the more low and moderate priced units in our community. But it's not happening fast enough. You know, and post-pandemic, what we're seeing, you know, one complex we work with where rents used to sort of hover between $500 and $700, they now raise their minimum rent up to $725, right? Which put them out of the range of any supportive housing program.
Yeah.
Because they can, right?
Yeah. Yeah, the market, it's dictating that. So this time has flown by, and this is such a big issue. We could continue to talk for hours about this. To close out, just a final question, and I think we've covered some of this. What is your biggest challenge for your organizations right now to the impact that you want to affect?
I sort of looked at this as sort of from a macro and a micro level. I mean, I think at the macro level, public perception around homelessness is pretty important. And income inequality. I mean, I think you've seen that thread through this conversation. And of course, just the lack of affordable housing. I mean, those are big macro challenges. I mean, sort of more of the micro for us as an agency at times, it is that human services in general are not structured in such a way that many of our unsheltered or chronically homeless people can even meet them.
Yeah.
So that's kind of some of the day-to-day challenge, right, that we run up against some of those barriers. But I mean, I would hate to end on a challenge and would just say that we do have a lot of hope that our community is capable of coming together to really make some solutions happen. And in the meantime, we'll just keep walking alongside those who need us right now.
Thanks, Ruth. I appreciate that. And it's a wonderful opportunity volunteering with your organization too. So I encourage people to look into that. And then Andrea, any final?
I mean, I think honestly, one of the biggest challenges we're having right now is housing supply.
Yeah.
We just can't move people into housing, and as Ruth said, on the other hand, we know how to do this work.
Yeah.
Right. And I think, when I think back, as we're talking through our goals, when our goal pre-pandemic was to end chronic homelessness, we went from 200 chronically homeless people down to 30. We can do that again. Like we know how to do that system work. When we shifted our goal to keep people safe, we did that. Right. And so we just need to be very mindful of that. We need to set goals and we need to work towards them. But in the 17, 18 years I've been doing this work, we have never had this harder time finding units for people.
It is a very challenging time in so many different ways, in so many different systems.
Yep.
So thank you so much for your time today, Ruth and Andrea. It's been a pleasure talking with you and hearing your perspective on such a difficult situation that we're in right now with housing, and just working to help provide services for our homeless population, and they impact so many different areas of our lives in our community. And if we're helping them, we're helping everyone. So that's what our goal should be. So we had some questions in the Q&A that we didn't get to, and if it's okay, we'll forward those to you, and maybe you can help respond to them post session. And I'm going to go ahead and hand the session back to Catherine to wrap up. But thank you so much for your time today.
Thank you.
And I'd like to thank Andrea, Ruth, and Melissa for so skillfully navigating this conversation topic. I'd like to thank all of our Leadership Winston-Salem family and friends for joining us and your continued interest in what happens to all of the members of our community. I would like to invite you all to join us for our next Leaders and Lunch, which is a date to be determined, but we are very good about communicating that with our alums. So keep your eyes peeled on your next available e-blast. I thank each of you for being a bigger part of a community that cares. So my thanks to each of you. And I hope you all have a great